The Department of Health remains vigilant amid reports of new COVID-19 variants, assuring the public that there is no current cause of alarm. Health Secretary Ted Harbosa emphasized that these variants are under monitoring and do not pose a significant health risk at this time. Vanessa Cleofas returns for the details.
After the recent report from the World Health Organization or WHO that new COVID-19 variants are being monitored, the Department of Health or DOH assured the public that there is no cause for concern yet. Therefore, they do not recommend tightening border control and mandatory wearing of face masks. According to Health Secretary Chodoro Herbosa, the new variants being monitored by the department such as KP.1 and KP.2 do not threaten public health yet. This is despite the increase in COVID-19 cases in Singapore due to the variants.
No requirement for border control, no requirement for mandatory masks, no requirement for additional vaccination. But we're monitoring the cases, symptoms, and fever. But I will not recommend any border control. It means banning travel or whatever to Singapore or to India. The caution is precaution mo. You must be vaccinated.
Herbosa also emphasized that these variants are classified as variants under monitoring, which means they are far from being public health concern. Additionally, the DOH has not observed an increase in COVID-19 cases in the Philippines, so they have not been able to obtain samples of these variants.
Although the variant isn't serious, that's why it's only classified as a variant under monitoring. Di ba may variant of concern and then yung talagang dinideclare nilang public health emergency of international. So it's under a variant of monitoring. Mabilis siya kumalat, so they're thinking nagwe-wane siguro ang immunity. Sa Philippines, we don't have enough samples kasi we need the number of samples to do the genetic testing. So ang report sa akin ng Epidemiology Bureau, we don't have enough samples that can be used for genetic testing. Pag dumami yung cases, then we will ask our Philippine Genome Center to again look at what variant is spreading.
The need for additional COVID-19 vaccination is also not necessary according to Herbosa, especially since most Filipinos are already vaccinated and have been received booster shot. In a separate interview, infectious disease expert Dr. Jean Solantes stated that existing vaccine no longer offer protection against the emerging new variants of the virus. However, like the DOH, he assured that these variants are typically just updates that will eventually fade away.
Because of the mutations, itong mga bagong variant, hindi na tayo protektado doon sa unang mga bakuna natin ng mga nakukuha, no? And in fact, may mga reformulated vaccines na, mga updated COVID vaccines, kaya lang hindi available yan dito sa Pilipinas.
However, COVID-19 remains a health threat, especially to vulnerable population with weakened immune responses. Therefore, continuous vigilance regarding symptoms is advised for these individuals. Although the DOH does not currently recommend tightening border control in the Philippines, from various countries, the Bureau of Quarantine or BOQ continues to monitor the health condition of tourists entering the country. The public is also advised to maintain minimum public health standards to avoid other illnesses. This is Vanessa Cleofas for EuroTV News.